Hello and good afternoon. I'm Dr. Carl Soderstrom from Peoria, Illinois. And in Texas, I'm known as Carl David's father. Back home, I'm known as a dermatologist who has several clinics, a large dermatology practice, as well as a large cosmetic practice. I'm very proud to be an investor in Health Wildcatters and very proud to be Carl's dad and the work he's done, and I'm very proud to be a mentor for some of the students and some of the companies that we've seen here in the last 3 years. Each year I've mentored at least one of the companies and worked with them, and in most occasions have their products or their ideas functioning in our office as a laboratory, but also in reality. One of the things I remember is when Carl was getting his MBA at Notre Dame, it was getting expensive, and he came home one time during a break and he said, "Well, Dad, think of it as seed money." And I said, "Well, yeah, I know, seed money. We live down here on a farm, so seeds you plant, money I try to save." And he said, "No, look at it a different way." He said, "Look at it, all those checks you're sending to Notre Dame." He said, "Look at it as seed money in my education. It's an investment." And I thought, oh, great. So I went around and told some of my doctor friends that I was seed moneying my son rather than paying his schooling. And the only problem is, as I stand here today thinking back, Carl and I had very different definitions of seed money, because I thought it was going to end when he graduated. And ever since then, Carl's had all of these ideas, and every once in a while I get a call and say, "Dad, you know about that seed money? I think there's a great idea out here and might be a good idea for you." Well, I've had the great opportunity of working with a wonderful new company this year, My Derm Portal. And this company is very dear to my heart. The folks that put it together came to my office a couple of months ago, worked with myself and my plastic surgeon and dermatology colleagues and my nursing staff. And we have about 220 employees. We see about 130,000 patients a year. So we have a great laboratory to try new things on. And Derm Portal came in, and we're able to talk to our patients, do surgery, operations, all kinds of plastic surgery, facelift surgery, dermabrasion surgery, cancer surgery. And now, with Derm Portal, we can have them send us a picture within a day or two and let us know how they're doing. They answer a few simple questions. We answer those questions. The reason I'm so excited about this, and it's been so successful in our practice already, that it's at home. The patient sends it right to us from their own home. They don't have to go out. They don't have to wait in the waiting room. They don't have to buy gas. It's easy for me because I can see 5 or 10 of these at one time over a 10 or 20-minute period and send them back answers and recommendations. Not only that, and I think one of the most important things, it's very, very interactive between the physician and the patient. And the patients love it, and it's been very fun. So it makes a fun aspect to healthcare as well as cost-effective and efficient. Now, the team that put My Derm Portal together include a couple of really remarkable people. And one of them, Paul Robichaux, who I'm going to introduce to you in a second, got an electrical engineering degree from Rice, and then went on to Michigan and got an MBA. So he was a perfect match for Vanessa Pena, who has a dermatology degree and took a year's teledermatology program at Harvard. So by putting these two ideas together, they have made My Derm Portal one of the most fun, effective, cost-saving, patient-friendly, doctor-happy programs I've really ever worked with. So at this time, I would like to introduce to you Paul Robichaux of My Derm Portal.
Yeah. Let's go! All right, okay.
Hi everyone, good afternoon. Thank you, Dr. Soderstrom, for such a generous introduction. My name is Paul Robichaux. I'm the CEO and one of the co-founders at MD Portal. The story of MD Portal starts with Max. That's because at 6 a.m. this morning, he woke up with an awful rash. He wants to see his doctor, and he wants to get it taken care of today. But Max is in luck. He knows about telemedicine so that he can see his doctor over live video chat. So Max waits 2.5 hours until his doctor's office opens. He calls and he tries to schedule a live video chat with his doctor at 10 a.m. when he has a break in his day. But his doctor's not available at 10 a.m. That's because she's busy seeing patients like she is all day. And this scheduling headache can go back and forth, and back and forth. It might be several days until Max can finally get a telemedicine appointment with his doctor. What's the use of telemedicine if Max still can't see his doctor for several days? The solution is MD Portal. It's an asynchronous telemedicine platform. It doesn't depend on your doctor's schedule, and you can start a visit anytime. Unlike live video, asynchronous telemedicine doesn't require any live interaction. It works kind of like email or text message. Now let's take care of Max's rash using MD Portal. Instead of waiting 2.5 hours for his doctor's office to open, he wakes up, he immediately goes to his doctor's website, he logs on to MD Portal. He answers a few questions specific about his condition, snaps a photo, and submits it. MD Portal immediately notifies his doctor that a new appointment is ready to be seen. And before she even starts her busy day, his doctor logs on to MD Portal, reviews his information, sends him a treatment plan for poison ivy, and prescriptions are sent to the pharmacy right down the road from him. That's it. MD Portal now makes it possible for your doctor to treat or triage you in as little as 2 minutes. That means a doctor on MD Portal can see about 8 telemedicine appointments in the same amount of time as it takes them to see one live video visit. Our business model is very simple. We charge the physician a one-time setup fee for custom configuration and then an ongoing monthly fee for access to the platform. Now, we're starting in dermatology with the platform positioned as My Derm Portal. You see, about 30% of doctors' visits are simple follow-ups and checkups. They get paid about $75 to $100 for these visits. But dermatologists also see lots of cosmetic and surgical patients, and they get paid anywhere from $400 to $2,000 and beyond per visit. By seeing more of those routine visits on MD Portal, it makes time in their clinic for those higher revenue and more complex patients. The net result is that a doctor using MD Portal has the opportunity to make over $100,000 a year in incremental revenue. But dermatology is just the beginning of a much larger opportunity. We plan on starting in dermatology and then going into hospitals and into primary care where there's over 300,000 providers, and then leveraging that presence to go into other specialties like surgery and beyond. We're different from the competition because we are an asynchronous platform. Live video might be convenient for patients. However, it's anything but convenient for your doctor. MD Portal is convenient for both the patient and the provider. And for those video-based competitors that are thinking about developing an asynchronous platform, we've got a significant head start. We've been developing the clinical content required for an asynchronous platform for over the past 12 months. Now, we have a sales strategy that is designed to help us reach scale in a highly fragmented market. We started with inside sales to get our first few paying customers, but we want to move faster, which is why we're developing partnerships with industry companies like pharmaceutical and medical device companies so that we can leverage their distribution network. And this is very real. We're currently talking with one of the largest dermatology roll-up groups in the country, as well as a large medical device company in the dermatology space. And we have plans to start pilots with both of these customers over the next few months. We launched not too long ago. We now have 9 paying physicians from 6 clinics all over the country on our platform. 2 of these practices have 40 providers, over 40 providers combined. With that and our pipeline developing with our industry partners, we anticipate having over 500 providers on our platform, and this is just with our existing pipeline in the next 12 months. We have a phenomenal founding team that is the reason we are successful today and thus far. We have a chief medical officer that Dr. Soderstrom pointed out, graduated from Harvard Medical School. She trained in dermatology under the president-elect of the American Academy of Dermatology. She has written papers on teledermatology. She has started programs in teledermatology. And we have a phenomenal CTO, Victor Luboslawski. He has over 15 years experience in high-tech space. He's a seasoned entrepreneur who sold his last company before joining us. We have just an amazing team. I myself have both experience in health and tech. I have an MBA from the University of Michigan, where I graduated with high distinction and was Entrepreneur of the Year. I've also helped consult with health systems, helping to streamline their telemedicine platforms. Our focus now is on raising our first seed round so that we can execute on the growth plan I outlined earlier. We want to hire 2 salespeople, an engineer, and over the next 12 months, our milestones are to execute on those 500 positions that are in our pipeline, to launch our new cosmetic module for the platform, and get to $1.6 million in annual recurring revenue in 12 months. If you'd like to learn more about our plan to scale our growth, I would love to talk with you after the presentations at the reception. Again, my name is Paul Robichaux. Thank you so much for being here today.